To my patient, I'm looking to see if I see any safety hazards like spills or cords that could hurt me or my patient. I don't see anything. I'm also observing my patient. She looks to be pleasant and calm. Her affect looks appropriate. Her skin color looks normal for ethnicity. She doesn't appear to be in any distress. I don't see any use of accessory muscles. I don't hear anything unusual. So I'm going to go ahead and proceed and enter the room. Hi, good afternoon, Ms. Goodfellow. How are you today?
Good, how are you?
I'm very well, thanks. My name's Kristen, and I'm a Palm Beach Atlantic University nursing student, and I'm here today to do a head-to-toe physical exam. Before I begin, I'll just provide privacy and perform hand hygiene. I'll set my stethoscope, I don't have a table, down. Would you mind if I check your ID bracelet, please? Thank you very much. Could you tell me your full name?
Mia Goodfellow.
And your date of birth?
11/08/2004.
Thank you, Ms. Goodfellow. Can you tell me where you are today?
The hospital.
And what year it is?
2023.
And what brings you in?
Just to get a checkup.
Okay, very good, very good. We're here for the same reason, so that's wonderful. My patient is awake, alert, and oriented ×4. When I checked your ID bracelet, I did not see an allergy band. Do you have any allergies?
No.
Not to latex, shellfish, adhesive tapes, medications?
No.
All right, very, very well. Are you in any pain today? Experiencing any pain?
Yes.
Yes. Okay, I'm so sorry. Can you tell me a little bit more about that pain? I would like to learn a little bit more about it so that I can take care of that the best I can and also be mindful during your assessment. Can you tell me where the pain is located?
It's located in my stomach.
Your stomach. Okay, I'm so sorry. Can you tell me when that began?
A week ago.
A week ago? Did something happen that kind of precluded that pain beginning?
No.
Okay, so it just started hurting a week ago.
Yeah.
All right. Can you tell me right now as we sit here how painful that pain is on a scale of 0 to 10, 10 being the worst pain you've ever had, 0 is none?
8.
An 8.
Yeah.
Okay. Can you tell me, have you tried anything to make it feel better?
No.
You have not, okay. And have you done anything that has made it feel worse?
No.
Okay, so the pain's just been a consistent 8 for a week.
Yeah.
Okay, well, I'm really sorry that you're experiencing that, and I hope that I can take care of that and help you feel better. Does the pain radiate anywhere?
Usually through my whole abdomen.
Okay, so it's throughout, like, the top, the bottom, the middle.
Mm-hmm.
And can you tell me a little bit more about what it feels like?
Just like stabbing in my stomach.
Stabbing pain, okay. Well, I am so sorry that you're experiencing that pain, and I hope that we can treat you and help you feel better. Do you mind if I'm cautious of your stomach today if I continue with the assessment?
Yeah.
Okay. And do you have any questions for me about the assessment before I begin?
No.
Okay, thank you so much, Ms. Goodfellow. So I'm going to start today with your hair and skin. I'm going to come around to the back of you. Do you mind if I assess your scalp? All right, so you're going to feel me kind of moving through your hair. What I'm doing is I'm checking the actual integrity of the scalp, looking for any bumps, lesions, excoriations, checking the distribution of the hair and the texture of the hair. Her hair is well distributed. It is of healthy texture, and she appears to be well groomed. I don't see any nits at the nape of the neck, and I also do not see any signs of non-blanchable redness at the base of the neck, which is a bony prominence. I'm also going to check her shoulders, her scapula, her elbows, her sacrum, and her heels. I don't see any signs of redness, but if I did, I would want to palpate that redness and see that that redness blanched. Non-blanchable redness is the earliest sign of skin breakdown. The next thing I'm going to be doing is feeling your skin for warmth and dryness. I'm going to start at the top of your head with my hands, hopefully not too cold, and work my way down your upper extremities and then all the way down to the tips of your toes. And I'm feeling for bilateral warmth and dryness, which is present and a normal finding. At the toes, I'm going to check that the cap refill on the nail beds is less than 3 seconds. And I'm also going to examine the ankles and the tops of the feet for any signs of edema or swelling. I don't see any edema. If I did, I would want to palpate that edema and check if it is pitting or non-pitting. At the fingertips, the same thing again. For cap refill, I'm going to just palpate the nail beds and check for a cap refill of less than 2 seconds at the fingers on both hands, which is a normal finding and present. And then for the test for clubbing, if you could take your 2 pointer fingers and point them together with your knuckles touching, I'm looking for a small diamond window to be present, which it is, which is a negative finding for clubbing. For tenting is the next test. I'm going to give your little forearm, give your forearm a little squeeze, excuse me. I'm going to squeeze and release, very simple, but what I'm checking for is the skin elasticity and that there's no tenting present, which means that you're well hydrated. Do you have a mole that you're concerned about today?
Yes, this one.
Very well, thank you. Let's take a look at that mole and see, let's evaluate it further. I see that the mole is symmetric. We want our moles to be symmetric so you can basically fold them in half. The border is well defined. I can clearly see where it starts and stops. The color is of light brown. Has it always been light brown?
Yeah.
The diameter is less than a pencil eraser. It feels flat, it's not elevated. And has it changed at all since you first noticed it?
No.
Okay, it's not firm, it feels the texture of the skin, and you said it hasn't changed, so that means it hasn't grown. All right, so based off of that assessment, I don't see any concerning findings. However, if you are concerned, it's always recommended that you trust your intuition and you can follow up with a dermatologist, especially here in South sunny Florida. Okay. If you don't have any further questions for the skin, I'm going to move on to respiratory. For respiratory, I'm going to start with inspection. My final piece of inspection for respiratory is assessing her AP to lateral ratio, which is a 1 to 2. She's negative for a barrel chest. The next thing I'm going to be doing is feeling your spine for pain or tenderness. So if you could just kindly roll your shoulders forward and kind of lean your head forward, that just makes it easier for me to palpate your spine. And you'll see me kind of wiggling, or feel me, excuse me, wiggling my fingers down your back. And if at any point this does cause you any pain or tenderness, just please let me know. How are you doing?
Good.
Your scoliosis?
Yes.
I can tell. Okay. And then sacroiliac tenderness, any pain there?
No.
All right, and then can you point to me where your last rib is? Very good. Okay, you're gonna feel some taps on your back. If this causes you pain or tenderness, let me know. Anything? Same thing on the other side, marking the base of the ribs. Any pain or tenderness at any point?
No.
Okay, so that's negative for CBA tenderness or kidney tenderness. Now we're going to start the auscultation piece of respiratory. I'm going to have you take a series of deep breaths, 10, in and out through your mouth. If you get tired, just let me know. It is a lot of breaths, okay? We can take a break and come back to it. Again, I'm going to start at the base of her ribs. Am I about right there? Okay, and come up to about the 10th rib space and auscultate. Hold on, let me feel my stethoscope. You can begin. Okay, Miss Goodfellow, go ahead. All the way to the end of exhale before I move my stethoscope. Ladder formation to the right side. Go ahead. Very good. And then for the sake of time, if I've demonstrated two breaths with the correct technique, I can skip the rest of the breaths and just show placement. So you can breathe normally. I'm just going to demonstrate for the class. 6, 2, fossa, and then arms out like an airplane or a letter T, mid-axillary. And based off of the first 2 breaths, all lung sounds are clear to auscultation. Thank you. You can put your arms down. The next test is a palpation technique called chest expansion. You're going to feel my hands kind of grasp your back, and then I'm going to ask you when I say to take one more big deep breath. All right? Okay, squeezing in and up. Go ahead. Very good. Okay, so my hands rose and fall symmetrically. That's a negative finding for a pneumothorax. The next test is tactile fremitus. Again, at that 10th rib space. This time, I'm going to be feeling for vibration. You can help me out by saying 99 nice and loud, okay? All right, ready? Go ahead.
99.
A little louder.
99.
More.
99.
Good.
99. 99.
Like a T?
99.
Very good. Okay, so that vibration was felt equally in every location, which is a negative finding for consolidation. The last test is percussion on the back. You're going to feel some taps on your back. This time I'm listening, so you can just relax and be calm, and I'm just going to listen to some sounds. And what I'm doing is I'm listening for resonant sounds. Go ahead, arms like a T. Resonant sounds indicate good aeration, and there's no hypo or hyper resonance. That could be, I think you can put your arms down, indicative of either consolidation or a hyperinflation. Okay, and the last thing for respiratory is the right middle lobe. So I'm going to have you take 4 more deep breaths, or I would. I'm just going to demonstrate placement for time. I'm going to start underneath the right clavicle, and I'm going to have her take another big deep breath. Don't do it. And then move to the other side, drawing a rectangle or a ladder formation. All right, and again, clear to auscultation for the right middle lobe. Now I'm going to move to cardiac. For this portion, you can now relax and breathe normally. It's actually easier for me to hear your heart sounds if you're relaxed and just breathing normally. Are you okay to continue?
Yeah.
Okay. So for cardiac, I'm going to start by listening to your heart valves. I'm going to start by finding your second intercostal space. So your clavicle, right below that is the first intercostal space. The rib, second intercostal space. Right at the sternal border is the aortic valve. Coming across the sternum to the left second intercostal space is the pulmonic. Moving down one rib space into the third intercostal space is Erb's point or second pulmonic. Coming down about a space and a half and starting to move to the left will be tricuspid. And can you raise your left arm in the air? Thank you very much. Fifth intercostal space, midclavicular line is mitral. And then I'm going to flip to the bell and come back up. I use the bell because sometimes I can hear certain murmurs better with the bell. They hear duller pitch sounds. Okay. Tricuspid. You can put your arm down. Second pulmonic, pulmonic, and aortic. All right, during my auscultation, I was able to hear S1 and S2. I hear S2 best at the aortic and pulmonic, and S1 louder at the tricuspid and bicuspid. I also want to point out that the mitral valve is where I would listen for the apical pulse, and it's also where I would palpate for the PMI. Okay. I didn't hear any abnormal heart sounds like S3 or S4, or any abnormal heart sounds like murmur or rub. So I'm going to have you lay down, get comfy, put your head on the pillow, and then I would go ahead and I would listen to these cardiac sounds again, because some heart sounds are positional, but because I did them correctly, I'm going to skip that, and I'm going to move to the arteries. So I'm going to be starting by listening to your carotid artery. If you can point your chin towards the ceiling, and I'm going to listen to your left carotid and right carotid. And I hear breath sounds, but I do not hear a bruit, which is what I'm listening to rule out. Could you point to the end of your sternum? Sternum.
Oh, my bad.
Thank you. Okay, and right below that is the aorta. Again, listening for bruit, which is a turbulent sound in an artery. Left renal, right renal. Point to your belly button. 45 degrees iliac, left iliac, right iliac, and stating femoral. At all those locations, I did not hear any bruits, which is a normal finding. It is safe to palpate your carotid since I didn't hear a bruit, so you're going to feel my fingers now on your left side of your neck, first palpating the carotid for pulse or strength and symmetry, excuse me. And then the other side, one at a time on the carotid for safety. Very good. Those are both +3 at the radial pulse. I can do together. Those are both +3. Stating femoral, stating popliteal, posterior tibialis is right behind the heel. I don't know if you have very thick socks, but I'm going to get that lucky. Oh, I do. +2. Those are good. Okay, and then dorsalis pedis, we're going to have to pretend on those, would be a +2. All right, and we're going to finish up the assessment with abdomen. We're almost done. I'm going to start with the inspection piece. I noticed that her abdomen is flat. I don't see any scars or striae, piercings, tattoos, hernias, and so I can begin. Do you have any pain? Oh gosh, you did. Okay, we're going to pretend you didn't so that I can do this piece, because normally then you would approach the assessment a little bit different. Okay. We're going to pretend she doesn't. And we're going to start with auscultation. If during the auscultation of the arteries at the renal and the iliac I heard vowel sounds, which I did, then I can go ahead and skip the auscultation piece and say that vowel sounds are present because I heard them in all 4 quadrants during auscultation of the arteries. So next I'm going to go to percussion. For percussion, I'm going to start in the right lower quadrant. Some taps around your belly. Using the umbilicus as a line, and again with clothing it kind of mutes the sound, but I'm listening for tympany, and we'll go ahead and say for normal finding of tympany throughout. Next test is for pain and tenderness at the right lower quadrant. You're going to feel my fingers touch your belly. Just let me know if it causes you any pain. Okay, right lower quadrant first, just about 1 centimeter, swirling motion, watching my patient's face, up to the right upper, and left lower. Any pain? No. Okay, next is for deep palpation. This one's going to be a little bit uncomfortable, hopefully not painful, let me know. Feeling for masses, so I'm going to use my right hand to push down, and then a rocking motion. Second. See, it's not that much fun, is it? It's like, very good. And one more. Very good. And there's no palpable masses, which is a normal finding. Very last thing, and then you're done and you're out of here today, is the palpation of the liver and the spleen, or my attempt to feel the liver and the spleen. I'm gonna do the hook technique, so I'm gonna be finding your ribs. I'm gonna take my fingers, it's like a bird trying to hook onto a branch, okay? And then I'm going to ask you to take one big deep breath. Go ahead. And as she does that, I'm pulling my fingers underneath and let go. Very good. Trying to palpate the liver. If I palpate the liver, it should be soft and non-textured. And then for the spleen, I'm going to reach my left hand across, and I'm going to put my hand just slightly underneath your back. Have you relaxed just a little bit? Kind of like fall into my hand, like lean back towards the bed. There you go. And then with my other hand, I'm going to place it right at the angle of the rib cage. And again, with a big deep breath, my hand's going to go underneath your ribs. Go ahead. Very good. And release. Very good. And I don't feel the spleen. There's no sign of splenomegaly. Okay, so Miss Goodfellow, I'm going to help you sit up. That completes your assessment today. Is there anything that you need before I go?
No.
All right, thank you very much. All right, Miss